Now, the members of the Ghana Medical Association at the 63rd General Conference has described as unfortunate the current menace of road crashes. Ghana has recorded 11,858 crashes with 2,126 casualties in the first 9 months of 2021. On the average, 6 lives are lost a day in Ghana to road crashes. Again, now let me take you through some of the wish list of the Ghana Medical Association, where they want government to take care of their recommendations to curb road accidents. So it says that the dualization of major highways in Ghana and intermodal transportation, where intermodal transportation refers to the use of 2 or more ways of transporting goods, as well as the conduct of a good road safety audit for the treatment of hazardous sections. It also says that the provision of rest stops every 80 to 100 kilometers along major highways to manage fatigue. Also, it says that the automation of traffic enforcement, as well as the continuous driver training and the training of trainers for motorcycle and tricycle riders. And finally, the regulation of commercial road passengers haulage and transport-related services there. Now let's speak with Dr. Titus Bayo, who is the Deputy General Secretary of the Medical Association. Thanks for your time, Doc. Your theme for this conference was the menace of road of our time as road accidents there. Out of all the causes of deaths, you're highlighting the causes of road accidents. Why?
Good afternoon to your viewers and listeners. And a little correction, I'm now the General Secretary and not the Deputy General Secretary anymore.
Okay, thank you.
And yes, the theme for the conference was the mess of our time, and we're focusing on road traffic accidents as well as galamsey, the havoc that these two are causing us. And for road traffic accidents, the numbers are alarming and unacceptable. To live in a country where 6 people die every day from road traffic accidents, statistics from the National Road Safety Authority, we found it unacceptable. So we put together experts for us to assess why this was happening. And that was what led to our recommendations that we've put out, which you have read it. And we think critically among all of that is that a health impact assessment must be done before the construction of major roads in this country. Before the construction of any road, they usually do a social impact assessment, they'll do an environmental impact assessment, but there is no health impact assessment. And from our expert opinion, if these were done, then some of these recommendations would have been made ahead to prevent the road crashes in the first place. For instance, when you make a very fine road that is traveling for hundreds of kilometers between regions, where do drivers stop to rest? And do we cater for trauma centers between these states so that if someone is involved in an accident, how far do we have to transport the person before they can get access to healthcare? So these were the reasons, some of the points that we raised, and we think that critical government must make it mandatory for both road, mining, and other major constructions that a health impact assessment must be done prior to the work.
Again, what is some of the impacts of road accidents on your daily duties as doctors? How does road accidents actually affect your jobs?
So unfortunately, we are at the receiving end. And now we want not to be at the receiving end. We want to be on the drawing table to prevent it. What is happening now is that the casualty happens, the passengers are carried, sometimes even the mode of transportation kills the people. How they are evacuated from the accident site lead to the mortalities. And so we want a lot of public education on it. Like I mentioned, if you look from January till now, how many people we've lost to COVID or to any of our major infectious diseases, none may compare with the road traffic accident that has killed over 2,000 people in 9 months. That's unacceptable. and some of them get to us in a state that we cannot do anything about. So we think the key is prevention and not the curative part when the accident has happened before they bring them to us.
Okay.
And the other aspect of the effect is that reimbursement of facilities who cater for accident victims. We have a law that says that if you are involved in an accident, first 24 to 48 hours, your care should be completely free. But that is not being practiced because the facilities are not being reimbursed with the money that they care for you with. So the person is brought in, is given infusion, given medications, and the money is not reimbursed from central source. Then what it means is that the next time another accident victim comes in, nothing will be available for that person. They have to pay out of pocket for it. And that is not acceptable.
Again, you also talk about post-crash challenges. Could you highlight some of these post-crash challenges for us briefly?
Okay, so briefly, the post-crash challenges, I mentioned some in passing, was how we evacuate persons who are involved in a crash. And then how we situate facilities along major highways so that they are easily accessible. And then the distribution of critical manpower, orthopedic surgeons, trauma surgeons, emergency technicians, and emergency physicians across our major highways. As it is now, if you go to the upper part of this country, if you take away Tamale and maybe around Dubaization, you are not going to meet an orthopedic surgeon anywhere. So if someone is injured between Bolga and Wa, how that person is going to get treatment is a challenge unless they are sent to Tamale or brought to Dubaization or brought to Kumasi. So these are some of the post-crash challenges that we think if we take care of, we can prevent mortalities on our roads.